Dealing with addiction while grieving. We almost always have questions when facing death, whether that's our death or the death of someone or something we love. People seek out answers in different ways. Some turn to friends, family, attend counseling sessions, read the Bible, or join support groups. People who believe they are incapable of dealing with overwhelming grief, even while avoiding it, may seek a substitute for the particular relation they have lost. They may marry again, adopt a new child, look for another mother or other family member figure in place of the one they lost. But when someone cannot cope with grief and wants to avoid the pain, they sometimes turn to addiction. Knowing how to handle addiction is a challenge. Addiction is an uncontrollable compulsion that relieves mental and emotional pain temporarily. An addict can become dependent on different substances, whether physically, psychologically, or both. When you think of an addict, what type of addiction do you think about? Most assume that an addict is strictly a drug addict, when in reality addicts come in many forms. For example, an alcoholic, a gambling addict, a sex addict, a shopping addict, or a food addict. All these addictions can spiral out of control, especially when a person does not learn to cope with grief and live a normal life after experiencing any type of loss. Coping with grief. The research suggests that approximately 27 million Americans regularly use illicit drugs, and 70% are employed. Workplace absenteeism, accident and injury rates, employee turnover, and increased insurance costs all go hand in hand with the use of illegal drugs. More than 15 million Americans aged 12 or older are estimated to be addicts by 2001. This represents 7.1% of the population. Almost 16 million require immediate treatment for drug addiction. This number does not include the other addictions that affect a person's emotional and mental state. Imagine a portion of that number of addicts are or were grieving. The tendency to use drugs or other things they become dependent on to relieve stress is not a given for everyone, but many people do become addicted. Substance abuse can be mental, physical, or socially destructive, depending on the substance and the individual. Some substances are also likely to cause physical dependency more than others. Some experts think that users may suffer from deficient brain reward systems. Others tend to self-medicate with drugs or other things that temporarily relieve the emotional and mental pain. For instance, cocaine can be used quickly to lift depression or help a person who suffered from attention deficit disorder become better organized and focused. Heroin, on the other hand, is remarkably effective at normalizing delusions and hallucinations in schizophrenia sufferers. People who are addicted to drugs, alcohol, food, sex, shopping, or gambling are struggling to deal with the side effects of attempting to relieve their own suffering. Even the emotional suffering of losing someone or something that they love. Addiction treatment usually involves putting one in withdrawal from what they are addicted to or psychological treatment, followed by attending counseling sessions and participating in self-help groups to resist addiction. Again, patients who go through therapy often find they are unable to calm themselves, especially when their stress level is high. Usually, grief brings on higher stress levels, anxiety, and other deficiencies. Someone grieving must continue treatment while they are grieving. The best way to prevent addiction is to not indulge at all, no matter the circumstance. Experts sometimes prescribe medications in safe amounts and monitor their use so that the patient does not receive too great a dose or for too long a period. Sobriety success. A person may get help to beat unhealthy dependence from the doctor, friends, family, and others, even those who have been in a similar situation. Recognizing the problem as soon as possible is critical, and you should not be afraid to get help and should never be resistant to ask for guidance when you are feeling triggered by your addiction. When a person is grieving, recovery may not be a priority at that time. When grief hits a person that is an addict, they need their friends, family, and recovery professionals more than ever. Seek help, be tough while being a part of the support system available to the individual.